Greeting to all. I am Prof.Jeya Vanitha, Child Health Nursing Department, SCPM College of Nursing and Paramedical Sciences, Gonda, Uttar Pradesh. By seeing this picture, what you all feel, you may come across any one of this, maybe depression, pain, headache, work pressure, etc. What will you do during this kind of situation? You may take rest when you're hospitalized, or you may take a pill for your headache. But sometimes, if the person having a severe depression, they may commit to suicide also. But apart from this, we had one solution for all these kind of situation. Yes, it's nothing but music therapy. I'm going to give us some of the valuable information related to music therapy. So I'm going to discuss about the impact of music therapy in physical and mental health. Music, it continues to play a vital role in India. It is spiritual and religious and ritualistic in nature, apart from being a socio-cultural experience. Also, it's a medium of prayer to seek help from God. It's a tool to meditate and relax and to keep one's body, mind and soul in a balanced manner. So in order to keep this balance, it is important as a cup of morning tea in every Indian individual's life. Of course, everyone is grown with some sort of lullabies and melodies. So music is an important part of everyone's life. So what is music therapy? Music therapy is a therapeutic approach that uses the naturally mood-lifting properties of music to help the people to improve their mental health and overall well-being, like to reduce anxiety, improve their cognitive functioning, promote physical rehabilitation, or enhance the interpersonal communication. So this all will involve by listening to music, singing, playing instruments or composing music. How it works out? When we listen to music, it is processed in many different areas of our brain. Not only one or two parts of the brain, nearly 10 parts of the brain are involving when we are doing some kind of musical activities. Here the auditory cortex, this is the first stage of listening to sounds that will perceive and analyze of the tones. We will see one by one what are all the parts involved when we are doing some kind of musical activities. The first one is the frontal lobe. This used in thinking, decision making, planning. So when we are doing musical activities, for example listening to music, this will enhance the function of the frontal lobe. That's why the frontal lobe is the most important to being a human. Second, the temporal lobe. Temporal lobe processes what we hear. We use the language center to appreciate music. That means we'll control both sides of the brain. Though language and words are interpreted in the left hemisphere, while music and sounds are interpreted in the right hemisphere. Almost it is like a non-linear in processing information. The right brain is adapted to visual imagery, and the left hemisphere sequential and linear in its data processing, moving step by step and processing a new information. So while most activities like visual art, computing and language largely work in only one hemisphere, but music is one of the few activities that stimulates both sides of the brain. Next, Broca's area. This Broca's area enables us to produce speech. So here this part of the brain to express the music, and when we are playing an instrument, that will improve our communication skills better. Next, Wernicke's area. This completely understanding about the written and spoken language. So when we are enjoying our musical activities, this part of the brain will help us to analyze as well as enjoy the music. And occipital lobe processes what we see. So professional musicians, most probably they will use this occipital cortex, which is mean visual cortex. So when they listen to music, but like us, we are using a temporal lobe. But professional musicians, they are using the occipital cortex. How? The auditory and the language center, which will suggest them both the hemisphere, both part, the left and right part of the hemisphere will functions properly when they are listening to music or when they are composing music or when they are playing an instrument. Cerebellum. We all know that cerebellum coordinate movement and it will store the physical memory. So this one a very important, the person those who are affected with the Alzheimer, elderly person, for them it's very helpful. Musical therapy is very helpful for them. An Alzheimer patient, even if he doesn't recognize his wife, could still play the piano if he learned it when he was young, because playing has become a muscle memory. That's why those memories never fade out in the cerebellum. Nucleus accumbens, it's one of the favorite place for the music. Actually, its function is seeks pleasure and reward and plays a big role in addiction because it releases the neurotransmitter dopamine. Neurotransmitter dopamine, it's a triggering of pleasure center. Means makes you feel happy. This response is so quick, so the brain can even anticipate most pleasurable peaks in familiar music and prime itself with an early dopamine rush. So music can be a drug, a very addictive drug, because it's also acting on same part of the brain as illegal drugs. So they are saying music increases dopamine in the nucleus accumbens. It's similar to cocaine. Next, amygdala. This process and triggers emotions. That is the functions of amygdala. So when we are doing musical activities, this one control the fear, like a fight or flight response. So when you feel shivers, it will go down your spine and the amygdala is activated. Whether you have to fight or flight, you will be having a fear of control. The fear will be controlled when we are doing a musical activities. Hippocampus. Hippocampus function is produces and retrieves memories, regulates emotional responses, and this helps us navigate. That's why it's considered as a CPU, central processing unit of the brain. So most probably the person, those who are affected with the Alzheimer disease, this is the first region will affect for them. So that will lead to confusion and memory loss. So once the people, those who got Alzheimer disease, when they are doing their musical activities, that music may increase their neurogenesis in the hippocampus. That will allow the production of new neurons and improving the memory, not only for Alzheimer disease, even for children, it will be helpful for them also during their studies. Hypothalamus, it's very important part of in our brain, maintain our body status, and it will regulate thirst, appetite, sleep, mood, heart rate, body temperature, metabolism, growth and sex drive. See how many functions this hypothalamus is doing. So there are so many research they have conducted. So they have concluded in that if we heard Mozart, that person those who composed this music, His name is Mozart. So if we are hearing Mozart musical, our heart rate, blood pressures will be reduced. So they were saying that the person, those who with seizure, epilepsy cases or any cardiovascular problem, for them music therapy is one of the best for them. Corpus callosum, this one will enable the left and right hemisphere to communicate, coordinating the body movement. That require logic means left side and intuitions right side. So the musician, they want to have the right hand side and the left hand side of the brain in coordinations. For example, if they want to translate on a sheet, the notes on a sheet, keynotes on a sheet, their fingers hit the produce music. So that's why previously I have told professional musicians, most probably they will use their brain, the parts of the brain lot than a lay person like us. Putamen, it processes rhythm and regulates body movement and coordination. So the person who got affected with the Parkinson's disease, for them this music therapy is one of the best. So when they are doing the musical activities, they want to do some of the functions like getting up and down and even walking. So when they are involving with the musical activities, that will assist in moving, and that music can help them a kind of like a can, like a stick, walking stick. Okay, so we have discussed nearly 10 parts of the brain are involving when we are listening to the music. Now we will see what are all the types of interventions in music therapy. There are 4 types: receptive, composition, recreative, improvisation. Because music therapists are trained in areas that equip with skills to assess, treat and evaluate the individuals of varying ages, their background and their needs. To accomplish all kind of these goals in a music therapy session, music therapist, they will prepare some kind of interventions within one of these 4 broad intervention categories. So we'll see one by one. The first one is the receptive. The client listen to music and respond to the experience silently, verbally, or in another modality like art or a dance. So here the music they are using may be live or a recording. Some types of receptive approaches may include music assisted relaxations, that is responding via dancing or a lyric discussion. So these goals may encompass several areas like promoting stimulation or a relaxation, or facilitating memory, developing auditory skills, enhancing mood and reducing anxiety. See how many goals when they are doing a receptive interventions. And the second one is the composition. Composition, it's nothing but songwriting. So a process whereby the therapist, they will support the client in creating their own music or lyrics. These creations may be recorded or performed thereafter. So we'll see what are the goals may be achieved through this composition or a songwriting. They will validating their experience. They will transferring their thoughts, their emotions, and they will promoting an alternative manner of expression, fostering a creativity. So these are all the goals when they are doing a composition or a songwriting interventions. The third one is the recreative. Recreative is nothing but playing or singing a song. Most of them we are using this recreative interventions only. Music centered approach in which a client is encouraged to play or sing along to a pre-composed song in a manner that support identifying their goals. So this recreation may involve singing familiar song or any new songs because that will strengthening the gross and fine motor skills of the patient and promoting the social interaction and talking. Also encouraging the use of one side of the body. That's why we can use this recreative intervention for children with developmental delays or seniors with dementia. And the last one is the improvisation. Improvisation, it's nothing but playing spontaneously. So this music making using a simple instruments, body percussions or the voice. This one facilitates the expression and communication through music, especially when verbal communication is limited or less comfortable. So these are all the type of interventions may be appropriate with some populations, those who are non-verbal or feel uncomfortable expressing directly. So these are all the types of interventions in music therapy. So your music tap into primal fear, makes you stronger, boosts your immune system, make you better communicator, makes you smarter, reduce seizure. So who can benefit from music therapy? Depression, mood related concerns, anxiety, schizophrenia, substance dependency, autism children, personality issues, insomnia, dementia. So this music therapy improves our health too, like effective therapy for stroke, effective therapy for pain. And this is an effective therapy for heart diseases too, effective therapy for Alzheimer's disease, effective therapy for autism. It improves our mood and decreases our depression. Useful for chronic headaches and migraine. Useful in epilepsy. Therapy for fatigue fighter. And it will improve the productivity of the company, organization. And it will induce us your sleep. Of course, improves our memory, intelligence, concentration and attention. So for all these, I am having a evidence-based research for reducing the headache, migraine and epilepsy cases, cardiovascular and overall the health-related problems. They have done more and more research about this music therapy. So herewith some of the evidence based on music therapy in a recent survey they have conducted by the museum, 73% of people they reported hearing a louder bird song during the COVID-19 lockdown in the UK. So many of them they said it's comforted and calmed them during crisis. So the research shows it's really good help improve our mental health. And one study showed that children who had 3 years or more musical instrument training perform, they are better than those who are not doing any kind of musical activities. So they are also tested better on vocabulary, non-verbal reasoning skills, which involve understanding and analyzing visual information. So music plays a vital role in recreate harmony and health. Modern music therapy provides healing system as a non-medical modifier and protector of the impacts of disorder. It is an integration of ancient healing practices and musical traditions coupled with the recent modifications derived based on the modern day practice and the knowledge gained by current clinical studies. In present, music therapy open great scope in healthcare sector and further research. So I am concluding with man's and other living beings under a range of frequency of sound influence the common and crucial life, that is music. So music is a magic key. Open every morning with that and close your blooming night too. Music wash us away from negatives, what we faced every day in our life. Hereafter, don't say, I am alone. Instead, say, I am living with my best partner, music. Music is not to hear, it is to feel. Take a habit of music track every day. When it hits you, you feel no pain, gain more. Life is a song, sing it. Without music, our life is mistake. Thank you all by Professor Jeya Vanitha. So with one song, I want to close my topic. யமுனையாற்றிலே ஈரக்காற்றிலே கண்ணனோடுதானாட பார்வை பூத்திட பாதை பார்த்திட பாவை ராதையோ வாட இரவும் போனது பகலும் போனது மன்னன் இல்லையே கூட Thank you for all for listening. I hope this topic will be very useful for you all. And all of you, please subscribe, share, and like this channel. Thank you all.